When diagnosed with diabetes, you will most likely be started on insulin. Insulin helps to move glucose from the bloodstream and into the cells, where it is used for energy. You may be started on insulin because your body does not make insulin or because it is not using the insulin you make properly. Managing diabetes with insulin doesn't have to be complicated. Today we'll go over different types of insulin, how to inject it safely, and important storage tips. Long-acting insulin is a set dose given at the same time every day to help maintain blood sugar levels. It works in the body for 24 hours and has a consistent effect on blood glucose levels. Common brands include Lantus, Basaglar, Tresiba, and Semglee. Rapid-acting insulin is used before meals and is based on pre-meal blood sugar levels and carbohydrates eaten. Common brands include Humalog, Novolog, Fiasp, Apidra, and Admelog. To draw up insulin correctly with a vial and syringe, follow these steps. First, clean the vial top with an alcohol pad. Second, draw air into the syringe equal to the insulin dose. Third, push air into the vial and flip it upside down. Fourth, draw up the correct insulin dose. Fifth, check for air bubbles and remove them if needed. For syringe injections, clean the skin with alcohol, pinch up the skin to increase comfort, insert the needle at a 90-degree angle, release the pinch and push the plunger in, count to 5 before removing the needle. For insulin pens, clean the pen top with an alcohol pad, attach a pen needle, prime the needle by releasing 2 units of insulin until you see a drop, set your dose and inject using the same steps as with a syringe, count to 10 before removing the needle. Insulin is administered in the fatty areas of the body. These include the back of the arms, the abdomen, avoiding the belly button, the upper and outer thighs, and the buttocks. It is very important to rotate between the different sites, as site rotation decreases the risk of poor insulin absorption. Store unopened insulin in the refrigerator. Once opened, insulin can be kept at room temperature for 28 days. Do not use insulin past 28 days, even though insulin remains in the vials or pens. Expired insulin must be discarded. Some insulins have different expiration times, so always check the label. Dispose of used needles safely in a sharps container or a labeled plastic container. Check your state's waste management website for disposal guidelines. Understanding insulin use is an important part of diabetes care. If you have any questions, consult your healthcare provider. Stay safe and take care.